Our discussion of the new Medicare CPT code 99490 starts here, with your chronic care patients. If their conditions keep you up at night, you've got company. According to the Government Agency for Healthcare Research and Quality, over 150 million individuals in this country are living with chronic diseases. That's almost 50% of our population. And that figure is rising at more than 1% a year. By 2030, the Robert Wood Johnson Foundation predicts that another 46 million people will be part of the chronic population. But as you have no doubt observed in your own practice, chronic conditions often come in multiples. Almost 2/3 of patients with chronic conditions have more than one, and 80% of the population ages 65 and older is living with multiple chronic conditions. That's 97 million individuals, nearly 1 in 3 Americans. One of the main reasons this can be a difficult population to treat is non-compliance. According to the International Journal of Cardiology, 66% of them don't take their medications as prescribed. Some of the non-compliance is due to cost. As you know, often they have multiple conditions and have to choose between medications, or in the example of one patient we spoke with, he could pay for insulin or he could afford the needles to take it, but not both. But often they simply don't understand what you've asked them to do. The American College of Preventive Medicine found that after leaving an appointment, up to 80% of the information you give a patient is forgotten immediately. 80%. And nearly half of what they do remember is actually incorrect. Adding to the problem, the average office visit is down to only 15 minutes per patient. That doesn't give you much time to understand their daily needs and challenges. You've got to hit the high points and move on. And chronic conditions are chronic, continual. So a visit twice a year can't keep you up to date with frequent changes that impact their health. For example, we recently spoke with a patient whose husband passed away 1 week after her last doctor appointment. She was left without access to regular transportation for food or medicine. He was the one who had driven. And of course, she was also facing increased depression and loneliness. In the normal course of events, her doctor wasn't scheduled to see her for another 6 months. She would have gone 6 months or more without the care he assumed she was getting, which, as you know, is an emergency waiting to happen. Adding complexity, patients aren't always forthcoming. Some see you as an authority figure that they don't want to bother, disappoint, or admit bad behavior to. And of course, patients aren't trained as physicians. They're dealing with the symptoms of their chronic condition every day, but may not recognize the difference between clinically significant and trivial events. So clearly with chronic conditions, you need informed, continual information, not twice a year, 12 months a year. Why is this more important than ever? Because the shift from fee-for-service to value-based care really means that Medicare is placing the burden on physicians to reduce acute incidence. In the face of rampant noncompliance, you can't do that unless you have a way to keep better track of chronic conditions. Which brings us to the new Medicare billing code, CPT 99490. CPT 99490 covers 20 minutes a month of non-face-to-face interactions on behalf of your Medicare patients who have 2 or more chronic conditions. Here's what it says verbatim. Chronic care management services, at least 20 minutes of clinical staff time directed by a physician or other qualified healthcare professional per calendar month with the following required elements. Multiple 2 or more chronic conditions, expected to last at least 12 months or until the death of the patient. Chronic conditions place the patient at significant risk of death, acute exacerbation or decompensation, or functional decline. Comprehensive care plan established, implemented, revised, or monitored. Providing chronic care management under the code is reimbursed a national average of $42.60 per patient per month. The patient pays a visitation fee, an average of $8, which is covered by many insurance plans. For a practice with 500 or more chronic care patients, this could add up to an annual $250,000 gross revenue. But let's dive down another step and look at some of the strict compliance guidelines that must be met in order to bill against the code. The code covers contact that is non-face-to-face, which means telephone, text, or FaceTime conferencing. The good news is that you, the physician, do not have to conduct the call yourself. A clinically qualified designee can do it under your supervision, or you can outsource. 20 minutes total per month have to be tracked and must be tracked separately from any other interaction. There are some tricky potential overlaps, especially with TCM, so it takes experience to bill this properly. And there's no partial billing. If you don't reach the 20-minute limit, you can't bill for the time. If you exceed the 20 minutes, that extra time is not reimbursed. And no, unlike your cell phone plan, the minutes don't roll over month to month. Before billing, you must explain the service to each qualified patient and obtain signed consent. We recommend the annual wellness visit as a good time. You must create a care plan for each patient, and the information from the monthly calls must be integrated into the patient's HIPAA-compliant records and made accessible to the patient and their relevant specialists and caregivers. You are required to provide 24/7 access to the service for each patient. That means staffing a person who's clinically informed about their case and able to answer their questions 24/7, not your answering service. This may be the most daunting requirement of all. Also covered is certain care coordination, including speaking with the caregiver or the specialist, or making an appointment on behalf of the client. Sounds pretty straightforward, yes? Well, yes and no. When we spoke with physicians who tried to implement this in-house, they found it burdensome, complicated, and non-remunerative. Why? One problem is time. By one estimate, chronic issues already take up to 36% of a practice's time. And as a practice grows, that time pressure increases. And then there's staff. How many of you have an office staff that says they aren't busy enough and would you please come up with something for them to do? Implementation may require new hiring with the attendant overhead and staff coordination issues. Overlaps with TCM and other codes make the billing tricky and collection uncertain. You may find the reimbursements don't match up with your forecast. But providing meaningful chronic care management isn't an option. CMS's shift from pay-per-service to a value-based payment model is coming and will be fully in place by 2017. So your question isn't yes or no. It's how. But here's the good news. The CMS has stated that a practice may use a subcontracted service, so long as it meets all of the Incident to and other rules for billing CCM, including applicable state and federal law, licensure, and scope of practice guidelines. And that brings us to Smart CCM, created to help you move your practice from fee-for-service to value-based care, starting with the chronic care management services covered by CPT 99490. The first smart thing about Smart CCM is that we hire and train certified chronic care specialists, currently all licensed nurses. They work in our care centers in teams of 2 per patient, grouped into a pod, supervised by a licensed nurse. The next smart thing is that we follow the care plan for each individual patient as approved by you, the physician. Let me stress this. They are your patients. We call on the name of your practice, we follow your care plan, and we notify you immediately if your attention is required. Our callers are clinically informed, but the actions belong to you. If during the course of the call any issues come up of which you should be made aware, you're immediately notified. The next smart thing is that all data collected is integrated into your EMR file for that patient in real time. You don't have to invest in new software. You can pull up a patient's file for their visit and immediately see the past year's data. And here's the real differentiator. We handle the Medicare billing. We bill Medicare on your behalf, and you pay us after you've been paid, meaning we take the risk if the minimum 20 minutes are not met. We bear the burden if the 20 minutes per month are exceeded, and we provide full documentation in the event of an audit. Smart CCM is a total solution for chronic care management needs for your patients and your practice. For more information, contact us at smartccm.com.